The patient came in about 1:30 in the afternoon, CPR in progress from EMS. We worked on this patient for a while. There were no positive results coming back from that, and Dr. Reddy, the doctor on call that day, had to call it about half an hour later, and she didn't have an AID. So she went into the system as a Jane Doe. So ER operated exactly like we usually do, which is we wait 2 hours, nobody calls, nobody comes, we have to transport the body. About 5:45, someone called in asking about someone meeting that description. We said, please come into the emergency room, we'll meet with you. When we asked, he said he was 15 years old. He had gotten to the ER by calling EMS, and EMS said, well, someone meeting from the address you're asking about went to Washington Hospital Center, and happened to be 15 years old, which means that we couldn't let him go home because there was no one there for him. The boy was stunned, obviously. It had been his mom. That's how he was related. I think our collective goal was to make sure that he would not have to go to Child Protective Services if there was family somewhere.
He eventually told us that he had an older sister, but he didn't have a phone number, an address, or where she worked. Then he remembered she worked in a big hotel in Washington, D.C. So I just started calling big name hotels and, does this person work for you? So I just gave him my number to every hotel I called, and finally she called. And I said, I got your brother here, he would like to talk to you.
What I think most people would do is make sure that boy was safe, and I think that everybody here at Hospital Center would do an extraordinary job to protect any of their patients, including the family. My name is Jaime, I'm an ER nurse.
My name is David, I'm a chaplain at MedStar Washington Hospital Center, and we personally make a difference.